2019, and this is our regular meeting of the Lane County Board of Commissioners. We do have a Board of Health meeting coming up very quickly this morning, but we thought we would try to take our public comment right at 9 o'clock for anybody that's here for public comment, and then we'll go into our adjustments to the agenda and remonstrance, and then our Board of Health. So please step forward, all of you who have signed up, and I'll take you in the order that I have. The first is Dennis Sandow. Welcome, Dennis, followed by Steve Dignam, followed by John Thielking, followed by Arwin Despain. No, just why don't we just take one person at a time, and thank you so much. And Dave, you're after Chris. Okay, welcome, Mr. Sandow, and please give your name and where you live, and our vice chair will set the timer for 3 minutes. Welcome.
Thank you. My name is Dennis Sandow. I live in Eugene on Fur Lane, adjacent to Maury Jacobs Park. Wanted to offer a couple of comments about the work session last night. Low-hanging fruit for you all who are worried about or concerned about money. Where does money come from to do this work? I'd have you take a look at the Community Care Organization 2.0 grant that was submitted by Trillium. That was designed by the state to look at provisions that would decrease preventable hospitalization costs. So the state health authority has said, we want the CCOs to do something about the health costs and the health risks of being poor. Really advise you taking a look into that. In California, the cost of type 2 diabetes and heart disease in terms of preventable hospitalization costs is over $5 billion a year. It's a lot of cash to invest in a solution. But the real reason I'm here is to ask you to do something kind of peculiar. I'm a peculiar guy. I don't know how this stands in terms of ex parte, but you all have an ex parte relationship with Homes for Good Board of Directors. What I'm asking is that you as a body pass a motion to ask the Homes for Good Board and Executive Director to delay the sale of the Lombard property for market level apartments until a public process can be instituted to discuss how that 3 acres can be used for transitional housing for homeless people with employment services and nutritious services. This is our opportunity. That 3 acres, as you know, is in the center of town. It has a high rollability index. It's perfect for people with physical disabilities. And it's the place in our community where our taxpayers has invested in a piece of land designated for affordable housing that can serve the most vulnerable people. I'm coming to you because, as you know, we've talked for over a year now, and you're the body representing Lane County's interest, leading the homeless issue that can do something. So again, I ask that you reach out to the Homes for Good Board and ask them to do the right thing by stopping this sale for market rate development and open up a public process to use that land for the homeless. Thank you.
Thank you very much. Okay, Steve Dignam, welcome, Steve, and please give your name and where you live, and we'll have the Vice Chair start the timer. Welcome.
Good morning, Commissioners. Steve Dignam, 82313 Bear Creek Road, Cresswell, Oregon. I recently retired after working 25 years downtown. I come today to speak against Measure 20-299. $252 million seems like a lot of money, especially based on my research that shows the federal courthouse was about 10% smaller, cost $90 million. Granted, construction environment is a lot different than it was 10 years ago, but that seems like an unreasonable, in my opinion, increase over what was paid for the federal courthouse. Furthermore, I received in the mail this very nice and informative flyer on Measure 20-299 that talked about, if the measure passes, the county is going to have 5 priorities. Local business, living wage, workforce diversity, sustainability, training, and apprenticeship. Certainly, I would support all of those social and goals. Everyone would. But I was struck primarily by a goal that wasn't in here. I was struck especially as one of the people that you're going to ask to pay for this measure. Nowhere in here does it say anything about your efforts to try to come up with the most cost-efficient and lowest cost design. It doesn't say that. Now, it's quite possible that you have done that, but you didn't tell me that. And therefore, all I have is 5 laudable social goals that you were looking at. So consequently, Commissioners, I intend to vote against Measure 20-299. It's certainly possible that the rest of the county will vote in favor of this measure. But if it doesn't pass, I thought you might want to know why at least one of your constituents decided not to vote for this measure. Thank you very much. Good day.
Thank you so much. Okay, John Thilking, welcome, and please give your name and where you live, and we'll give you 3 minutes. Welcome.
Hello, I'm John Thilking. I live in Ward 1, Emily Simple's ward in the City Council of Eugene, Ward 1. A couple of things. One is that I started a new project called thebusStation.org, where I'm going to, as of October 1st, assuming I save up my own money and enough in time, or I get donations that may launch this sooner than October 1st, I will be offering homeless people and others, anyone that wants a locker for $15 a month, a 4.5 cubic foot locker for $15 a month, in any kind of retail establishment that will accept a bank of 12 lockers in place of a vending machine, because they're about the same size as a vending machine, the group of 12 lockers. Also, I'm a little bit annoyed with the story I heard about various people testifying last night at the Eugene City Council meeting about what's happening at Free Speech Plaza. Apparently the people are really suffering for not even being allowed to hold an umbrella like this over their head, because the Eugene Police Department has it in their head last Saturday to ban even holding an umbrella like this over someone's head to prevent the sun from shining on them, versus what the people at the permit booth were saying, that you could actually hold an umbrella. That whole scene is just totally unacceptable. I know I stated last month that I was prepared to have a second burial of Wayne Morris because of the deaths of the Free Speech Plaza, and I stand behind that statement. Thank you.
Thank you. Okay, Arwen Despain, welcome.
Good morning. My name is Arwen Moss Despain. I live in Eugene and South Eugene. I am here kind of wearing multiple hats. I am the director of Carry It Forward, which is a small nonprofit that works in Eugene, Springfield with the homeless population. We do a number of different pilot programs related to employing homeless folks and having them serve the community in different ways. I'm also the clinical supervisor for the FAIR program, which is a mental health and drug treatment program at OSLC. And we do a lot of outreach, actually. I'm proud to say we serve all of these towns except 2 of them, and in the community. Like 85% of our services are in the community. So I listened with great interest to your work session last night, and identify myself as living a lot in the perimeter and the fractured core of what was described for the TAC implementation. So I'm very much interested in the notions of the Navigation Center. I'm very much interested in the outreach teams. I've done a lot of work with Occupy Medical myself and done a lot of that sort of triage diversion process, trying to knit all our services together in a very small way. So I have three requests that I'm going to try to rattle out here before my time's up. One is that as we move forward with our implementation, especially of the measures that are the immediate pieces, that we are doing a much better job of including the smaller organizations in the process. In terms of many of us are doing really effective work on a small scale. I don't want all our eggs to be in the St. Vincent de Paul basket. I know that they do a lot of good work, but they can't do it all. And we have to be collaborating across all of us and knitting us all together. I'd like to have more inclusion of rural voices, and I know that you all are more tapped into that idea than the city council is, and I think that it's going to take your pushing for and collaboration to keep reminding people that Eugene is not Lane County. And then lastly, I would very much like more inclusion of homeless voices themselves in the development of these measures, because who knows better what they need than folks who are living it day to day. So I appreciate your time. Thank you.
Thank you. Chris McAllister, followed by Dave Piccioni.
Thank you, Mr. Chair, Madam Chair, members of the commission. My name is Chris McAllister, and I come from Springfield. I was really excited to hear the conversation yesterday about the TAC implementation, and I really appreciate everybody being on board. Since that's all out of the way and we already have a plan, let's talk about stuff that you guys can work on that's not TAC related. I'd really like to have people consider the decriminalization aspect of what happens when we have people who have no place to go. In a couple of days, the governor's going to sign, or has already signed and put into motion, something that's going to clear out people from a place that has been a refuge when there's been no other options along our rivers. Having sleeping bag, fire, all these things that keep people safe in these kind of middling times where it's not quite hot, not quite cold, not quite dry, it's a problem. And we keep looking to the state for answers to fix it. We hear about rent control and all that. That doesn't help the people out on the street now. That doesn't help the people out in the elements now. And so I really implore, when people were talking about cost yesterday, that people look at this from a public safety, public health, emergency preparedness model. We have cannabis revenues that have been tagged by the state and by local for public safety, public health. We keep finding people and calling criminal trespass too because of public safety, public health. So why don't we put our money where our mouth is and start funding public safety, public health pilot projects? 6 units spread throughout the town, put them in every district. Maybe we can try and secure $100,000 per county district to start to actually put pilot projects in the community needs. The late Mayor Sandra Larson was a very strong proponent of testing things out in the communities where you are from. And so she was a strong champion for Veneta doing things. And I wish that we had other examples in other communities where they step up. My town of Springfield is talking about serving families. We want to make sure that they have enough tools and resources to make sure that they can adequately serve families, not have a couple pilot projects, move forward, get defunded, and move out. So I really implore people to put money this year, this summer, towards things to help build a solid infrastructure for TAC to take root. We have a variety of ways to do things. Another thing I wanted to draw attention to is the CTE focus that we have in the state. It's already being tooled for our high schools to integrate into our vocational programs that are our LCC program. Why are we not doing the same kind of programming with our unhoused displaced workers? We have an opportunity. We're bringing people from the industries and having them take teaching degrees and then putting them out into capstone projects and into curriculum building. Why are we not doing that with our underserved and displaced workers? Just a couple more thoughts. I really appreciate the work that our staff has done. I really appreciate the leadership of those who have been proposing ideas in the TAC implementation and the works before. And I really hope that we do not lose momentum because the time is now. I really appreciate your time and your service.
Thank you so much. Okay, Dave Piccioni. And is there anyone out there that hasn't signed up for public comment that wants to give public comment? Okay, very good. Okay, Dave, you're up.
Thank you, Pete. You've probably heard me talk before about the population problem. This is not going to get easier, it's going to get harder. The population, according to the internet, is growing by 1%, 1.1% to be exact. But so if we have a world population of 7.5 probably around now, 7.5 billion people, 1%, which doesn't seem like a lot, amounts to $75 million, 75 million people, not dollars, 75 million people. The country of France has a population slightly smaller than that, 67 million. So that means that every year that goes by, considering the entire planet, there's going to be an additional population size like they have in France. And I mean, I don't know if that means much to you, but it's a country, it's an entire country. There are other countries that have comparable populations. It's hard to talk about population because the question always comes out, well, so who should we stop from having babies? So I'm not here to give you that answer, but I can tell you it's a big problem because nobody wants to see their culture disappear because there's too many people in the world. I really don't know what to suggest, but people have to be motivated to do this and educated about it, and given the protection for conception if they want it, and explain to them that this is an important way that they can help the entire world. So this is not just for the U.S. U.S. I don't think is growing in population size, but worldwide, I think.
Thank you. Thanks very much for your public comment today. Okay, and while the public's here, we'll go to our commissioner remonstrance. And do any commissioners want to give any remonstrance? Jay.
So could I quickly ask the administrator maybe to address the construction auditing firm that's going to be utilized during the courthouse construction, seeing we had testimony concerning cost control about the courthouse construction, and maybe that's not well advertised in our information, but there is a plan to keep that cost under control. You want to speak to that quickly?
Happy to, Mr. And Commissioner Bozovich. Actually, in your ballot language, there's a requirement in the ballot language that says that the county will conduct a financial audit of the project. Furthermore, we've said and stated publicly repeatedly that we're going to pursue hiring a construction auditing firm that will review in real time invoices from contractors and subcontractors to make sure that we're only paying the cost for the project that we're absolutely responsible for paying. And then maybe finally, we've said and made the commitment that this project, the $252 million project, is an all-in cost. So it's everything from land acquisition to planning and design to construction to furnishings and equipment to contingencies and inflationary costs. The total cost of the project, including all those things, will not exceed $252 million. Our goal is going to be to bring that number below. And certainly if we don't need to levy all of the amount, if it's approved by voters, then we won't do that. So we've made a number of things in the 4 values that we've established for this project. You know, they include accountability, transparency, collaboration, and financial stewardship of taxpayer resources. So we're very much committed to making sure that we spend only the dollars that we need to and that we're accountable for everything that we do spend.
Thank you.
Any other commissioners? Commissioner Farr?
Thank you, Mr. Chair. A couple of things very quickly. Mr. Feldkamp, I wrote down notes on what you were saying. I'm very interested in hearing more about lockers. When I hear issues that people who don't have a place to live one of the big issues is I lose my stuff. If I leave, I lose my stuff. Well, you're proposing something that seems relatively low cost, relatively well distributed, that can be a way for people to keep their stuff. Mr. Feldkamp, thank you. Feldkamp. King, excuse me. Thank you. I've taken down the notes. And Arwen, I'm going to call you by your first name because we usually do when we see each other. When I saw you outside today, I said, how are you doing? You said, I'm tired. Well, no doubt you're tired. I look at the list of things that you do in your spare time is remarkable. You carry it forward. You talk about employing folks. What you didn't talk about was how many pieces of clothing and sleeping equipment that you recycle back into the system for people to get fresh, clean clothes and fresh, clean sleeping bags that otherwise they'd be sleeping or living in their well, I'll say the word sometimes disgusting situation that, and you've described to me how you go into tents sometimes and you put on the gloves and you haul the stuff out and you clean it. It's an amazing service that you provide. And Chris, you and I talk all the time about six, in each of the different districts having 6 Conestogas. How much impact would that have? It'd be pretty remarkable. One last thing I'll say, Mr. Mokrzycki, is yesterday I was very proud to be at AOC for the Veterans. I'm co-chair of the Veterans Committee, and I'm also on the Health Committee. And what I'm proud of is not me being there, but the things that I get to hear about and talk about. And I'm looking at the folks from our Health and Human Services Department right now. At both meetings, Lane County was singled out as being a leader, and I'm not going to go into the specifics because we talk about them very often, but as a leader in veterans services and as a leader in healthcare modernization. We also talked about the Aid and Assist program and how that people are very realistic about what that does. And we also talked about crisis center and the potential for diverting people from jail. In all of those discussions, Lane County, they look to Lane County as a leader, and it's pretty remarkable, the county of our size, when Washington County is sitting in there also, when Multnomah County is sitting in there also, as well as Gilliam County and Deschutes County. So it makes me proud to just be able to repeat the words that you give me to repeat. Thank you very much. We're doing well, a lot to do. Thank you, Mr. Mokrzycki. Thank you, Mr. Chair.
Okay, are there any other commissioners that want to be recognized? Commissioner Burney?
Is it Arwen? I'm sorry. We don't know one, and I apologize. I just want to underscore my agreement wholeheartedly with your point of including small groups, small nonprofits, the fabric of who's really out there on the street with people in the planning and in the implementation, as well as rural communities. So I just want to say thank you. Couldn't agree more. I also agree with your point of having those who are homeless in this instance speak for themselves instead of people like us speaking for them. This has been an issue for me in a variety of programs, from school reform to low-income housing. So often the social engineering will construct a program without speaking to the people who are the beneficiaries and who through that process can be empowered, et cetera, et cetera. So I thank you for that. Chris, everything you said makes total sense to me. I want to thank you for your input you sometimes give me in terms of educating me, in terms of what's on the ground in our community, as well as other communities. And I would just simply like to state that people like you, to me, are the true heroes. Not those of us that, this is the first time in my life I've been in this position, but those of us who are in positions that are recognized by the public. It's our honor to facilitate the work that people like you do. So I just wanted to thank you.
Just quickly, you had mentioned making sure that rural communities are involved, and I've been a strong advocate and will continue to be making sure throughout the process that we do that. Those mobile response units will be a real big way of doing that and making sure everybody who's trying to do work for the community surrounding the TAC report are included at every level, whether they're just one person who wants to do good in the community to large organizations. So I appreciate you saying that, and I will continue to advocate for that as well.
I'll just take a minute or so on the remonstrance or comments about people that have come here today. First of all, I'll just take people in the order that they testified. Mr. Sando, I said Sandow, I'm sorry, Sando. Thanks so much for your suggestion, both about the topic of housing generally, but also specifically the Homes for Good board meeting. I really appreciate that suggestion. If there's support for that, I'll certainly be supporting that. I typically don't make motions here at this board meeting. Mr. Dignam, I think he left, but I do respect people that come in and tell us why they're voting the way they're going to vote. It's not required. Most people don't do that, but it was helpful to hear some of his comments. I don't agree with him, but because I did vote yes on the measure, but it is good to hear opposing points of view. Mr. Thelking, I really appreciate this suggestion because every time I've had a conversation with a homeless person, the issue of what's going to happen to their stuff comes up. And so the idea that a nonprofit group or just an individual is going to go out and try to do something about this problem, and then maybe other people will catch on and the idea will move forward with more energy, than one person can put into it. I think it's a great thing, and thanks for doing that. And then, Mr. McAllister and Ms. Despain, innovation in business or innovation in social services often not come from the larger, more established organizations. They are now in an organizational sense, whether they're a corporation or a nonprofit, they're about perpetuating their own existence. And I'd like to think that a government as old as Lane County, going back to 1851, that we are still an innovative, active organization. But I think it's fair to say that when you look at organizations, public, private, nonprofit, that there is a period of time in which that organization is more concerned about itself than it is about the mission for which it was established. And that's something that, since we're in a really old organization, we have to be really mindful of that. And since you're in, the go-getter, we can do this, more activist organizations, you also need to benefit from the fact that that's a really unique role you have right now, to be that kind of energizer to get other people to do and step up. So, and I'm grateful for the feedback from our commissioners that are more involved in the housing policy issues, because recognizing that these good ideas and energies come from the grassroots is really, really important. I appreciate that. And Dave, thanks for coming in to talk about population control and population explosion. I do think it is a big problem throughout our world, and very few people really talk about it. So thanks for coming in and giving that perspective. I want to get into our adjustments to the agenda before we call up Karen, just because some of these things involve the commissioner's schedule. So for today, just to bring to your commissioner's attention, today the Budget Committee meeting is at 2 p.m. It's been advertised at various other times, so if you want to be there at the start of the agenda meeting, or if the public wants to watch the beginning of the agenda meeting, it'll start at 2 p.m. today. There is no executive session today. Something that is not on our current printed or noticed agenda is we are contemplating an executive session for Thursday at 4 p.m. This week. So please check with Diana Jones if that's at all possible for you to attend the executive session if we're able to pull it together on Thursday. and she may be polling the board on other times as well. And then last but not least, I'll bring up two items. I guess I'll just bring them up under other business, but there's two letters that have come in that I'll bring up under other business later today, having to do with the DUII impact panel and the census. And those are largely referral issues to the board or to the administrator. So there being no emergency business, we'll now recess our Board of Commissioners meeting to allow our Board of Health meeting. And if our Board of Health folks could come up, we are now in our recess for our Board of Commissioners meeting, and we are now going to start our Board of Health meeting. And that is item number 1A, which is a semi-annual Board of Health report. And we have Ms. Karen Gaffney, Director and Public Health Administrator, Dr. Patrick Ludke, Public Health Officer, and I don't see us, but I think it's Dr. Jocelyn Warren, yes, Public Health Manager. We set this up for a 15-minute presentation and 3 minutes per commissioner thereafter, so welcome.
Good morning, Chair Sorensen and Commissioners, and I'm going to steal just a couple minutes of the presentation time that Dr. Lutke and Jocelyn will be giving to give you a couple updates. As you know, our semi-annual Board of Health report is really focused on all of Health and Human Services, and we lift up a particular topic each time, and Dr. Lutke and Jocelyn will talk about that, but I do have a couple other updates I want to share with you, and then we're happy to answer whatever questions or discuss anything that's in the printed report after the presentation. The first is that I wanted to give you an update on the Armory. As you know, several months ago, we talked with you about a temporary solution for the Armory, which has been vacant for some time, and I realized last week that we hadn't had an opportunity to give you an update on that, so I wanted to give that for you. We did work with Public Works and issued a request for letters of interest to the community. We received one letter of interest in mid-March for that, and that organization has done 2 on-site visits to the Armory to see the facility and get the specifics about what the building needs are. We aren't in a position yet to be able to contract with that entity because they're still trying to determine whether they're going to be able to use the building as is, and in which case they would use it mostly for storage and perhaps the parking area, or whether it's feasible to do some improvements to that project. So just wanted to let you know that's why you haven't heard anything back on that yet, because we're still working with the one entity that expressed interest. And then the second is to follow up on an email that I sent this weekend. I know everybody gets lots of email, so in case you didn't have an opportunity to see that, it seemed appropriate today, since you're meeting as the Board of Health, to talk about the upcoming delegation of the Public Health Administrator role from me to Jocelyn. She's really done an amazing job leading our Public Health Division, and this enables her not only to continue that work, but also gives her some opportunities statewide that really come with having that particular designation and title. So we're excited about that part of the work, and I wanted to at least call that out in case you had any questions or wanted to talk about that after the presentation as well. So with that, I'm going to turn it over to our presenters.
Thank you, Commissioners. We're happy to be here today to present our semi-annual Board of Health report. We're going to be talking about the county health rankings. So that will be our first piece. Will be describing the overall approach of the county health rankings. It's a very popular population health approach to evaluating a community's health. So we'll talk a little bit more about the model itself. We'll review our 2019 county health rankings for Lane County and then highlight some of the key findings. So the County Health Rankings and Roadmaps is a project of the University of Wisconsin and the Robert Wood Johnson Foundation. It has two overarching goals: to improve the health outcomes for all and to increase health equity. It began in 2011 and it's released annually to coincide with National Public Health Week, which is typically the first full week in April. It is the most widely recognized public health surveillance system in the nation. The counties are ranked within each state, as you'll see. In 2011, when it first started, Lane County ranked 18th in Oregon among counties. In 2016, we were at number 12, and this year we're at number 11, so that's good news. Despite the limitations, and there are a number of limitations with sort of large data sets and population health data, it's kind of a broad stroke. But the rankings themselves have built awareness of the multiple factors that influence health and have been a resource to support community health improvement efforts across the country, because for each of those rankings and the outcomes that they include, they also provide information about programs and things that can be done locally to address those particular issues. So that's a great resource as well. So this is the model. If you, this is how they decide the rankings. The health outcomes really represent kind of a current look at what the health is like in the community, and that includes length of life and quality of life measures. The health factors are projecting, so kind of what the health will be in the future as well. So we can take a look at both of those things. The health outcomes include health behaviors, clinical care access. Health factors include social and economic factors and the physical environment. So we'll start with the first, try to get through these. We won't go through all of them because there are quite a few and they're included in your Board of Health report. But we want to highlight a few things. Premature death, and if you look at the green arrows, the color represents whether or not it's going in the right direction. So that's the trend is good in terms of premature death. It's decreasing, the arrow is going down, but it's going in the right direction. We still have a higher rate than the state of Oregon. In terms of quality of life, there are 4 factors that go to making that measure: poor or fair health, poor physical health days, poor mental health days, and low birth weight. So among those, we rank a little bit better on poor mental health days than the state, and poor or fair health is a little lower. We rank 17, so the rank on the end is how we rank in the state compared to other counties. So health outcomes overall is at 11, and that's combined length of life and quality of life. Health behaviors, we rank pretty well in the state at number 8. Our adult smoking rate is at 15%. Adult obesity rate, as you see the arrow there, is going up and is red, means that it's increasing among adults. We also have food environment index, physical activity, access to exercise opportunities, excessive drinking. We'll talk a little bit more about sexually transmitted infections in our comments. Those are also increasing. I think that's a story you've heard from us for several years now. Our measures of clinical care, we also rank fairly well in clinical care, 11th in the state. I'm sorry, I'm going to let you talk about clinical care. Okay. I'm going to share.
So a couple measures that I wanted to highlight under clinical care. The first is the primary care physician ratio. Several years ago, we had kind of a mass retirement of primary care providers in our community, a significant number at the Peace Health System, as well as some of the other larger practices. It was a very challenging time in healthcare. We were forced, some willingly, some not, to adopt electronic health records. There were changes in the way we coded all diseases in this country. We went from what's called ICD-9 to ICD-10, and which basically went from some 50,000 codes to about 150,000 different codes for healthcare, and it was a real challenge. So we are stabilizing from that. The other one I wanted to highlight is the fact that we, I believe, are the largest population in the country that does not have a primary care residency. Even Klamath Falls has a primary care residency. Somehow we do not have one. We have been working with a variety of groups to try to get one into our community, but we really we really are affected by that. People tend to end up practicing where they train, and we don't have that opportunity. We don't have that pipeline. Next slide, please. So social and economic factors, again, I'd like to highlight a couple. Our high school graduation rate, I think each of you probably know we're not a model citizen in the country for high school graduation rate. Nationally, it's about 85%. We are in 73% in Lane County. We have a real challenge there. And of course, a lot of health outcomes are affected by both the education achieved or attained by a person and their jobs. So education is quite important. And we have a long way to go to even get up to the national average. And then also the item of childhood poverty. You can see the red arrow, meaning it's going in the wrong direction. We have an ongoing challenge with poverty in general. And I routinely, I think some of the old timers on the board know that we oftentimes in public health compare ourselves to Clackamas County. They're a little bit bigger than we are, about the same social makeup, but they make household income about $50,000 a year. I'm sorry, we have about a household income of $50,000 a year in Lane County. Clackamas County, it's $79,000 a year. So a huge difference in income, and that affects poverty in adulthood and poverty in childhood. So we have a ways to go there.
You say the income levels again? I'm sorry.
Household income in Lane County is about $50,000 a year. Clackamas County, $79,000 a year. Large difference. Next slide, please. The physical environment, I will only highlight two areas there. Air pollution, which we'll highlight in our comments a bit more. We have an ongoing challenge, not just in bad fire years, probably a surprise to no one, but the severe housing problems. We have discussed this at other times in the Board of Health reports. The metric for the county health rankings really includes 4 pieces to it. The first 3 are not overly applicable to us. They include a housing complex not having a complete kitchen, a housing complex not having complete plumbing facilities, a complex that is overcrowded. We have a little challenge with that, but the last one is the big one, the high cost burden to the persons who live there. We have a real challenge with that metric, which is why we don't score so well in the severe housing problem column. Next slide, please. So teasing out.
We're going to try to get the presentation, and then we'll get going.
Very good. So in our comments, teasing out, I mentioned we would pull out air pollution a little bit. Some things are stacked against us. We're not going to change the fact that we're in a valley. We have the coastal range on one side and we have the Cascades on the other, and we're at the bottom of that valley. That makes it difficult for air to churn and get out and be cleaned. But we also have ongoing challenges with the more routine fires, and of course we're concerned about that and how we're going to deal with it. And each year we prepare. Typically in April, May, we start talking with our preparedness team about how we're going to prepare our communities for fire and air quality issues. And especially if some of those air quality issues are long-term. If we have 2 or 3 weeks and people have ongoing cardiopulmonary problems, do they have enough medication? Because they're going to have to get out into bad air to go pick up their medication. How do we prepare our community? And we're concerned about that long-term. Jocelyn mentioned STDs, STIs. You have heard before about the challenges, and it's not just us. Across North America, there are huge increases, and even in Western Europe, actually, large increases in bacterial and viral sexually transmitted infections. Last year, for 2018 data, we hit a modern-day record, unfortunately, for gonorrhea in our community, 509 cases. When I moved here 8 years ago, we had about 90% fewer. We had around 50 cases, very sad number. To be increasing so much. And then the final bullet in our comments is the high rate of violent crime and injury deaths. We didn't tease that out. We encourage you to look at the full county health rankings report and the metrics involved in that. But it's an interesting area to look at in more depth. Next slide, please. Air pollution, we're higher than the state average, again, partly because of the geography that we have. We are not a young population. At our last Board of Health report, I mentioned that we're about 10 years older than the youngest state, which is Utah. Our average age in Lane County is 39. And as we get older, we lose some of our cardiopulmonary ability, and air quality can really affect the older part of our population. And we see that each year when we have especially bad air quality linked to fires. I do want to mention that the Cleaner Air Oregon, that initiative that Commissioner Bosevich and I were on for longer than we wished, I think is safe to say, will be rolling out some of its new improvements and recommendations, and perhaps it will make a difference. But Lane County Public Health will be working with LRAPA quite a bit on how it is that we're going to address the new requirements that Cleaner Air Oregon has mandated. Next slide, please. I'll finish with a little more information on STIs. We have some interesting dynamics on sexually transmitted infections. I mentioned gonorrhea earlier. Most of the cases of gonorrhea in the country occur in men. We're one of those counties where it's about 50-50 male-female. We don't quite understand that. The states above us and below us, it's mostly men. We have just a handful of counties in Oregon where we have roughly an equal rate, and that's an ongoing concern to us. We need to better understand that, so of course we can work on prevention messaging and prevention activities. We did have a small improvement in one of the other sexually transmitted infections, syphilis. Unfortunately, this year, for the first 4 months of this year, we're on track to be bad again. But even though we had a slight improvement, it's still more than 3 times what it was 10 years ago. And this is during a period where our population only increased 6% in that time period, and we are seeing, 300, 400, 500% increase in some of these conditions. So this is an ongoing concern for us. I'll turn it back to Jocelyn now.
Violent crime. We wanted to highlight violent crime because this is an example of the county health rankings giving some information or providing some direction around policy opportunities around certain areas. And one of the things that they highlight as an evidence-based approach to reducing violent crime is childhood home visiting programs. And I wanted to remind you of our own childhood home visiting programs that we have in public health. We have the Nurse Family Partnership Program, as well as Babies First and maternal case management. We may also in the near future have universal home visiting offered if that is approved at the legislature this year. That is among the governor's priorities. According to the policy information at the county health rankings, home visiting programs can be thought of as diversion because they reduce child injury and maltreatment and improve a range of child and parent outcomes, including social, emotional, and cognitive skills of children and maternal health and economic security. So we've prioritized those in public health, and particularly at-risk populations, including teenagers, those who are unhoused, who have experienced partner violence and other trauma, and who have substance and addiction problems. Going forward, if it becomes more of a universal program, we'll be reaching far more families with home visiting, which is actually a much shorter term home visiting proposal. So we'll talk more about that as that becomes clear. And I think then there was one other we just wanted to highlight as well, is injury deaths. That includes both planned and unplanned injuries that are higher in Lane County than the state average. Locally, we've been doing a lot of work around preventing and responding to suicide, as you've heard from our suicide prevention coordinator, Roger Brubaker. Prevention staff are also collaborating with clinical and community partners to prevent opiate addiction and overdose. And then finally, reducing traffic fatalities through environmental changes, enforcement, and education is the focus of that multidisciplinary team, the Fatal Crash Investigative Team that's led by Public Works and on which Public Health also sits. I think that concludes our presentation. We're happy to answer questions.
Okay, well, thank you very much. Commissioner Bozievich.
Thank you. So I had 2 quick questions. One is the water quality violation that said yes. And I have no knowledge of any of our large systems declaring any sort of major violations. So I'm kind of perplexed by why we have a yes on that. Is that the public water systems we're talking about, or is there something else that they're, I don't even think
I believe it is public water systems. I'm happy to get you more information on that particular measure.
Yeah, because Sub and eWeb are our 2 largest providers in the county. I don't think I've seen either of them declare boil water or have some kind of notice go out. Most of the major cities, the larger incorporated cities, I haven't seen issues with. So that one jumps out at me as, okay, that one looks like bad data. The other one I'm kind of curious about, and I was trying to find online, is the particulate matter and what they're exactly measuring. And it looks like they're doing average daily density of fine particulate matter. But the question I have to get to is how they're doing that, because we have several places we measure that in the county. But if they include Oak Ridge, it skews our way off. And it's no worse than the American Lung Association, who ranks us really low because we have these violation days in Oak Ridge, and they tar the rest of the county for Oak Ridge, when almost all the rest of the county, and if you did particulate matter in Florence, it's almost zero, because, we have the Pacific, and the ventilation there. So I'm kind of curious, whether that's another piece of data that's getting skewed by one measurement station that is, and the way they put these measurement stations in is they develop models and put them in the worst place. So the one in Oak Ridge is specifically cited in the absolute worst spot in Oak Ridge for particulate matter. Likewise, the ones that are in Eugene and Springfield are also cited that way, like the one, that's why the measurement stations in the Amazon, next to Amazon Park there, because that little finger of a valley is a little pocket that forms rather regularly and gets high particulate measurements. So I'm kind of curious. That one's always perplexing to me, having sat on LRAPA's board for so long and understanding really what a good job we have done in controlling that in this county, although the uncontrollable events like wildfire we can't deal with. So those are just a couple I had some questions about, and I guess you'll follow up on the water quality violation one for
Absolutely.
me. And I'm going to try and read further into their information about their air quality ranking, but my guess is we're being skewed by Oak Ridge.
I'll just mention that the water systems are for any connection that supplies water to 25 people. And so while Eugene and Springfield both have, by and large, good water, it's these smaller systems, and I know at roadside rest areas where they have developed toilets which were thought to be far away from the well at the roadside rest area. They've had migration. So that's another example. And I think I would join the request to have you maybe send an email to the board and just sort that out. Commissioner Farr?
Thank you, Mr. Chair. Drs. Warren and Ludke, thank you very much. Karen, Ms. Gaffney, thank you very much. What a great presentation with some good results, but who likes being number 11 out of 36? I mean, if you're in baseball, if you're bat 33, 33, you're doing pretty well, but in this field, we'd like to be 1 or 2. But I'm looking at the reasons that we're number 11. A lot of them that we do have direct control over as a health department, we address, and we tend to percolate or bubble or surface to be among the leaders. But some of the things that we may not think of as being things that we can directly address, I'd like to talk a little bit about how we do address them and how we are making strides in those areas. And I'm looking at health behaviors in particular. So adult smoking, people make the choice to smoke, right? So there's nothing we can do about it. But I'd like to say that we do. We've addressed smoking, and we found ways to induce people to not start smoking, induce people to stop smoking. And sometimes it's not very popular, the ways that we do it. So that's a big one for me, is smoking. So could you talk just ever so briefly about that? Because I don't want to take up the commissioner's time, because I have a couple of other points to make. What are we doing? What have we done for smoking? For instance,
Happy to do so. Commissioner Sorensen, Commissioner Farr.
We're only 1 point below the state average.
We are, and the national average is about 14%. And it has been coming down over time, and perhaps being replaced somewhat by vaping, unfortunately. So I think this board has reason to be proud of the activities that it's done, at least in the 8 years that I've lived here. We have moved to have smoke-free county properties, first sort of building by building, and then moving to a broader smoke-free status. We were a big champion of the Tobacco 21 and tobacco retail licensing to address the issue of underage tobacco use and to try to prevent people from starting smoking when they're 12 or 13 and then develop a lifelong habit and the health consequences that go along with that. And we also, or the board has also taken action on vaping and had pretty broad discussions about it as well. So I think there's reason to be proud. There are other opportunities where perhaps we are not afforded activity that we would like, so there's still preemption in this state. That's a challenge. We are, I think we're the second lowest tobacco tax state in the West. If it weren't for Idaho, we would be the lowest of 20-some states. And the states below us and above us geographically have $2, $3, $4 a pack taxes on tobacco, and they have very, very low tobacco use. Those two correspond quite well. It's interesting, Utah is the lowest tobacco use rate in the country. It's about 8.5% of their population, probably cultural and religious. But California and Vermont, very different states, are also in the single digits, the only other states that are. And they have taken this on as a state. And I think the board could get help from the state for this. Hopefully this $2 a pack tax will go in during this session, will be helpful to us.
And we'll use the $2 wisely. Okay. So thank you for that, Dr. Ludke. So while we are doing things about smoking, we've taken great strides. We still have work that we can do, and we'll be aware of that. I'll check off my going down the list. Adult obesity. That's another area of interest and concern and attention for us. We're at 28%, the Oregon average. Still, we've gone up, so clearly we have more work to do there. And rather than ask you to comment, I'll get through my checklist very, very quickly so other commissioners can have a chance to make their comments. Food environment, we're 7.4, lower than the Oregon average. 1 out of every 3 kids will eat from a food box this year. Lane County, when I was the executive director of Food for Lane County, even with Food for Lane County, we were the hungriest county in Oregon, the hungriest state in the nation. What a horrible place to be. So we clearly have work to do there. Physical inactivity, we can encourage that. There are ways that we can address all of the points on health behaviors that really seem to be beyond our direct control, but we can influence. And that is what I'm really witnessing our health department do, is influencing people to make decisions regarding their own personal health that are their own decisions, but we're helping them to recognize decisions that they can make and make what is a healthier decision. So finding ways to have people choose to make a healthier decision is what we can do to influence the behavior, the things that we don't have exact direct control over. Now, one thing that we do have a little bit better control over, perhaps, is the ratio of primary care physicians or primary care providers to population, where we're low, very low. And you mentioned, Dr. Ludke, one of the main factors, we don't have a residency program in Lane County. We've known that for a long time, and 8 years ago was when I first started preaching about that, and we continue to have no interest from our large healthcare providers. Talk about that. How do we get a residency program here? I've seen attempts. What can we do? Why doesn't Peace Health? Let me get this straight. Why doesn't Peace Health have a residency program?
Commissioner Sorensen, Commissioner Farr. So I will not pretend to speak for Peace Health, but I will tell you, when I first moved here, there was a big movement at Peace Health to add 4 residency programs. They were looking at peds, internal medicine, family practice, and psychiatry. And the healthcare, this is my personal view, the tumultuous changes in the healthcare system made that effort go away for a while. Obamacare came into being, CCOs came into being, just some significant shifting sands. And we tried, Karen and I are on the board of directors of Trillium. We had several conversations with the board, with the CEO there about how can we as a community support and how could Trillium support a residency program as well. I do think that healthcare is still fairly tumultuous, and getting commitment from the big players in this arena is difficult at this time. Now, that being said, and I said it earlier, if K Falls can have a family practice residency, it seems hard to justify the fact that Eugene Springfield cannot have one. We just need a commitment, and I think it needs to be pushed by many players to make it happen.
And I think we can be one of those players in a greater way than the Board of Health has been. You know, and the primary care providers don't have to be MDs. We know that. They can be nurse practitioners. They can also be, what does Western University turn out? About 28 to 35
doctors of osteopathy.
DOs. Exactly, who can be primary health providers. Wouldn't it be wonderful to have them come down here and do a residency program? Wouldn't that be a marvelous thing? They're in Lebanon. they can walk here. So those are my points, is, things that seem beyond our control really are within our control, and we're doing something about it. And additionally, primary care physicians, we have a dearth, and we need to do something about that. Thank you.
Okay, any other questions, comments from commissioners? Go ahead.
I'm wondering where you think you see the most promising aspect in improving this report that you think has a broad impact. What is the good stuff you see coming down the pike?
Well, I think there is a big opportunity with sexually transmitted infections. We have a new grant around HIV prevention and response, and that's allowed us to hire additional staff, and we're convening now a lot of the local people involved in HIV and STIs to develop a strategic plan and think more system level about how to address this issue. So I think there's a lot of opportunity there, and I'm looking forward to that work going forward and engaging more people in this work, because now we've just really been spending most of our attention on responding and tracking, but we haven't been able to do a lot around prevention, and that is really the place where we need to focus our attention. So I'm looking forward to doing that going forward. That's a big one. You probably feel strongly about that too.
We might all briefly weigh in. My observation as I looked at this list is really how well it meshes with your community health improvement plan, and that the goals you identified in that CHIP are around social determinants of health, so that maps to the social and economic factors, and then the health behaviors piece. So really, I would suggest that following your CHIP is absolutely the roadmap to continuing to see these numbers get better. And I agree with Commissioner Farr that no one wants to be number 11, and I want to recognize that it's better than what we were in the past. So I think we continue to make progress following that roadmap. Dr. Pat, did you want to nominate a place? Start?
I believe, thank you, Karen and commissioners. I continue to believe, and this may be reiterating a bit what Jocelyn said, that we have huge opportunities in a prevention dialogue with the community. And there are opportunities in the social media world that we are taking a little bit advantage of, but not as well as perhaps we could have. There are opportunities in school systems. As we have seen school systems lose school nurses and lose some of their infrastructure, we've lost some of those abilities. And when you have a captive life for 7 hours a day in a school, we should take as much advantage of that as we can in terms of health messaging and healthy behavior conversations. I think we have real opportunities there.
Thank you, Mr. Chair. Is there any, I have several questions. One of the things that you mentioned was you reviewed in the past a large wave of retirements and how that impact. What is your anticipation in the future? Do you see that happening again with some significant impacts in the near future?
Commissioner Sorensen and Commissioner Bernice, so thank you for the question. If you look at the national data for primary care providers, I believe the average age is either 51 or 52. This is not an old, not a young enterprise. And we're not minting primary care docs as much as we probably should. Now, we do have a growing enterprise of nurse practitioners and physician assistants. The numbers are increasing, and I think they're picking up some of the slack. But I fully anticipate in the next decade, we're going to see, again, a fairly significant retirement of middle-aged and late middle-aged primary care providers, not just in Lane County and Oregon, but in the country as a whole.
Thank you. And I noticed most of your comparisons were with the state of Oregon and how we as a county compared with other counties. Now and then you would mention national comparisons. Do you happen to know off the top of your head against all or any of those indicators how Lane County compares with other counties nationally?
That's not part of the county health rankings, so I'm not sure that I could do that. If you are interested in looking at how adding a column about where the U.S. stands on those measures, we could do that.
Do you have any data as to where Oregon ranks compared to other states?
Yes, they actually and this is new for the county health rankings, they do now, because there's also a state health rankings report, and that's actually conducted by a different organization. But the county health rankings has also started producing state level reports, so that's also available. It's just kind of a roll up of all the different counties, but you can see how the state then compares to other states in the country.
Okay, well, I think some of that would be insightful for us.
Sure, I can
think-
include that.
I think that an impression I have, and this is the For What It's Worth department, an impression I have is that our systems of monitoring data, and I appreciate the utility and need for that, are better than our control of behavior out there. And that's troubling. I also assume, but I don't assume this is correct, I'm just me, that if you wrap all of this up, what we're really looking at is, are people happier and healthier? And I don't notice any indicators that kind of go towards that, which is actually, I believe, part of the preamble of the Constitution. So I'm just, you know, I know that's abstract, but I just wanted to make that point. I also wanted to state, interestingly, that you mentioned the Robert Woods Johnson Foundation as the group that did the original work. And I don't know if you're aware, but the person that was the lead of that original work for Robert Woods Johnson came from Eugene, Oregon. You know Mr. Royer. And if you know him, and I've mentioned this, I don't know, he's someone I used to know. He's always had a real interest in our community, and he's very seminal with a lot of these national health foundations. And I don't know if there's any opportunity to generate more resource for some innovative stuff, especially if I heard you correctly, around prevention, and what are some innovative ways to engage the community in dialogues, whatever those issues are. I have some thoughts about that. I know I need to stay in my lane. I'm learning to do that. But nonetheless, I can't believe that if we did have some innovative solutions that get at that, which my understanding is an issue for every community across the United States, that to the degree he's still coherent and informed and engaged at the age of 80, he would probably go to bat for us. So I just wanted to mention that also, and thank you very much.
Okay, well, thank you very much. Okay, let's try to take a sense of, we had planned this for 30 minutes, so we're about 20 minutes over. Going to keep going?
1 minute.
Okay, well, very good. Go for it.
Just want to note, looked at in the data, the air pollution data sets from 2014, the water quality violation sets from 2017. One violation in any community health system earns you a yes, which means it could be a 10-person system.
So I think we're done. Thank you so much. We really appreciate this. Thanks for all your great work and for answering our questions. And I'm sure you're open to emails from us. And if the public wants to email the commissioners on what they'd like us to do or not, thank you very much. That will conclude our Board of Health meeting. So at this time, we're reconvening our board meeting, and I want to go to the consent calendar next, and then we'll have county council, and then we'll have county administration. So let's first move to our consent calendar. This is our item that is the agenda team puts this forward as item relatively non-controversial items. And so at this time, I'll take a motion to approve the consent calendar.
So moved.
Okay, it's been moved by Commissioner Buck to approve the consent calendar as presented. Is there a second? Okay, seconded by Commissioner Bozovich. And all those in favor, please say aye.
Aye.
Opposed, say no. And the consent calendar is adopted by a vote of 5-0, all commissioners voting aye. We'll have the county council up after county administration announcements. I know you want to give an elections update, Mr. Mokrajewski. Please proceed.
Just a brief update. This is all I have, Mr. Chair, is voter turnout through Monday, yesterday, May 13th, is 28,139 ballots, or 10.8%. When compared to a similar election for odd-numbered years, we're in line with the May 2017 returns. In 2017, we received 28,889 ballots, so That's about 750 additional in 2017 through the Monday returns. The last day that's recommended to return a ballot through the post office is Thursday. After that, it's recommended that ballots are returned to one of our 20 official drop site locations. So you make sure that it gets there by the 21st. A list of the drop site locations can be obtained on our website at lanecounty.org/elections or on page 20 to 39 of the county voters pamphlet. Opening and pre-inspection of ballots begins on Friday. We'll utilize approximately 110 extra help to successfully complete the required tasks for this election. So it's good to know it's actually really helpful to us, and it lowers the cost to manage elections if you vote early. If you vote early, our regular full-time staff can process those ballots. When folks vote late, we get a lot of late ballots, and so we have to staff up with extra help for that process. So another good incentive to vote early. Thank you. That's all I have.
Okay, and while we're awaiting Mr. Dingle for the county council portion, we'll call up Ms. Moody for item 7B. That's a report in the matter presenting the third quarter FY 18-19 financial report. And with us to present this is Christine Moody, Budget and Financial Planning Manager. This is a very busy time for our Budget Committee, and Ms. Moody as our Budget and Financial Planning Manager. We set this up for a 5-minute presentation. Welcome, Ms. Moody.
Thank you, Chair Sorensen. Commissioners. So this is the third quarter, and you saw me present the second quarter not very long ago, but we're getting caught up here again so that we're back on schedule. So this is through March 31st of the fiscal year. So I thought I would just highlight a few things in the report and then open it up for any questions. The first thing to note is that the road fund is no longer part of this quarterly financial report. It no longer really qualifies as a distressed fund now that it has the additional funding from House Bill 2017. So we went ahead and removed it. If there's any desire to have reporting on that fund in the future, we can definitely bring it back for once a year reporting or whatever the commissioners would want there. So highlighting the CPI growth happening at the national level, calendar year over March to March is about 1.9%, whereas fiscal year so far this year is about 1.4. So the last time I came to you, I noted that we'd had a couple months of no growth in CPI. That has started to turn. So you'll see the chart on page 2 of the report showing you month by month, so you can see that February and March have both started to indicate increases there. Not much change in unemployment. If anything, maybe even down just slightly, about 3.9, 3.8, whereas it was about 4 in the past, but staying very low there. I provided some information on employment job growth in the Eugene MSA, there by industry or by county, so you can see that there and the sectors that are seeing that growth. I did also include excerpts of an article that I found from one of our state employment economists on household income, the deeper dive into the median income that I thought might be of interest to the commissioners. Specifically, it looks at the changes that occur with age and then also race and ethnicity. Some interesting data there. If you want to have the full article, I'd be happy to send you the link there. And then real estate, of course, we watch that to see the median home prices and the average. Year over year, the median has gone up about 5% and the average almost 4%. And then I do have a handout for you on the land management building permit data. Received that after I did the report. I went ahead and provided for you more than just 1 year glimpse, just because it appears that in late 16-17 and through 17-18, things were a little bit higher. So I wanted you to see the trend over about 4 years. It is down a little bit this year compared to last year. But then if you look at the trend over that time, you'll see what's changing there. So with that, I'm open for questions.
Just one point on building permits, as a reminder that building permits tend to be a leading indicator of economic activity. So as we see longer-term trends of either increase in building permits or decrease in building permits over periods of time, it oftentimes can be an indicator of what the broader economy is doing.
Okay, are there any questions for Ms. Moody regarding the third quarter financial report?
Just, do you ever get to go home?
She was here at 7:30 on Friday night.
She gets to go home in July.
There you go, yes, summer in Oregon.
Somewhere after June, so. I have a question about this graph you just put out, and it's very helpful to see that big jump in the FY 17 fourth quarter for the residential. The commercial looks like it's been pretty steady through the whole thing. Could you give us an idea what that was back in the bad old days of the Great Recession, like in, say, first quarter '09 or second quarter '09?
I'll have to get that for you.
Yeah, yeah. I really appreciate this sort of quarterly look, because it does, as Mr. Mokrzyski points out, it is kind of one of our better indicators of how our local economy is doing to get, and this is just from our land management.
Correct.
This isn't
The cities,
this isn't the county-wide data, it's county data.
Right.
Lane County government data. So, yeah, this is LMD. This is the county government's land management. So this is unincorporated Lane County largely, okay. So who does maintain a larger data set of building permits countywide? Anyone?
might have some of that data. I'll check with A&T and see how, they're going to get reports on any of that.
There may be a state agency that keeps track of
HBA,
that.
Home Builders Association.
Yeah, Home Builders Association might have that publicly. Okay, and thank you very much for the report. Is there anything that the board particularly needs to decide other than you have it, it's here, it's on the website?
Yes.
Okay. Anything further from board on this? Okay, seeing.
Wait.
Oh, wait.
Were you?
So I guess Joe was just asking me,
Sorry.
Yeah.
the LMD information too is just number of residential permits. It could be a housing start for a $500,000 house, or it could be an $8,000 kitchen remodel. Is that true?
I believe so, yes.
Yeah,
I'll
yeah.
verify with them
So-
the
so that-
range, yeah.
So, you know,
Separate.
what value of permits might be more useful
Okay.
number than number. You know,
Yeah.
if the dollar value of permits, which I know they do track that also, so that may be a differing trend. But I do agree, you know, without this, the cities issue the majority of building permits and value of building permits because of our land use laws concentrate development inside urban growth boundaries. So this is just a really, it's an interesting data set because it kind of, you know, it'd be interesting maybe even to compare it against the incorporated cities, because when you see us doing a lot of permitting, it means that there's pressure on the land we're trying to preserve because we're not meeting that demand inside the UGBs. So that's, you know, that's really, you know, when you look at what LMD is doing, this is a reflection of not meeting demand inside UGBs.
New housing starts is probably a good one to look at. The other one that would be interesting, and I think from the policy perspective for the board, to look at the countywide, including all the municipalities, focus more on housing starts. The other two good pieces of leading economic indicators at the local level are water and sewer permits. Permits are, you know, if someone's taking out those tend to be the leading indicators because developers are first making those infrastructure improvements before they're actually doing construction on a lot of those units. So we can look at some of those things if the board is interested in those broader leading indicators.
This board member is very interested. I went from saying this is really great, you know, I really want to get a perspective on this, to realizing what would really be useful is maybe 15, 20 years worth of this, to learning from Commissioner Bozovich that actually this isn't that insightful at all. So my heart went up and down. Housing, as you said, Mr. Mokrzyski, housing starts. the water use items, the value of the permits being requested for the county aggregated. I don't know if this is possible. This is my wish list for the county aggregated and then broken out by some of our key metro areas. I think that would give us tremendous insight into what the picture looks like. Again, I don't know what's possible. I'm not asking you to. I understand the demands on your time.
And correct me if I'm wrong, but isn't this report a report of Lane County government's financial condition? And it's really, this graph is really to show the variance in how we have to staff up a particular department and how because they have a workload issue of that big jump there in the fourth quarter compared to, say, what might be called their average load by quarter that we could see as a relatively straight line across there. But they have to staff up, and then what do? They have to staff down, and that creates all kinds of problems. So it's valuable in terms of the county government's budget and management and finances, but for this bigger thing that I brought up, if we could get, that annual data just on building permits, then, and maybe there's a state agency that compares that against what's been going on in the state, and it wouldn't be something you have to put into this report, but it's something the board is obviously vitally interested in knowing. Are we at a point where there's good news ahead, or maybe not so good news ahead? And that's what this might help us understand.
The purpose of the report is really both. It's to look at broader local economic indicators, so the board is sort of thinking broadly about we even include some national data in here, thinking outside of the organization, the community, and state and nationally, and then that we drill a little bit. We don't have to do these reports. We started this 3 years ago, really just so that the budget, so that like the month of, or the couple weeks in May that we're in right now, we're not the only time we were talking about, but we wanted to integrate it into the fabric of our organization from the top down, that really financial management is something we need to do every day. So that's why we do these, and it's really helpful to get feedback from the board about, this is only valuable if you find it valuable, because we don't have to do it. So it's helpful to know what things are meaningful to you, and so this is all really, really good feedback. So we will keep doing the economic indicators that you're interested in and refine those things, and then if there are particular areas of the organization, like we're talking about the general fund, as Christine said, we've taken the road fund out because it's just there's not a lot to report. It's in pretty good shape. The general fund is structurally balanced, but we want to pay attention to things driving that. If there are other funds you're interested in diving into, we certainly can do that. Or if you're just more interested in a local economic update, we'll focus more on that. And we are bringing
Regional
Brian Rooney.
Yes, I plan to reach out to him for the next
once or
report.
twice a year, so sort of rotating on up.
Twice a year.
Yeah, he's really the person
Yes.
that is very knowledgeable about these matters.
This is just his data that I'm going to find. Yeah, a lot of
Hey,
it, yeah.
Commissioner Farr, then Commissioner Bozovich.
Thank you, Mr. Chair. This is kind of way down the list of discussion, but of course it's important because the financial stability of the county doesn't just occur outside of city limits. And so the information on housing starts, as you pointed out, Mr. Mokrajewski, it is one of the leading indicators of the financial health of an area. And last time I checked, Eugene and Springfield, inside the UGBs, are in Lane County. So it does have a direct effect on how we are able to weather the economic storms the ups and downs of the economic storms. But significantly, what we have to remember is that the city of Eugene made a decision to not expand its urban growth boundary for residential, stating that they have enough supply of land inside the existing urban growth boundary for 20 years of housing development, of residential development. Now, much of that land is in the South Hills of Eugene, where the lots are very, very expensive to develop. Very little of the land is in the flatlands. All of this has a great deal to do with the economy, and all of it has a great deal to do with Lane County's stability as a government, all very, very important. Part of the upshot of that is every square foot of land in the more developable areas of Eugene will be used for its highest residential purpose, because the city of Eugene will not expand its urban growth boundary beyond its current limits, which have been set for almost 30 years now. For 30 years they've been saying we have a 20-year supply of land, and now they continue to say we have a 20-year supply of land. The math is kind of hazy on that. But the fact is, no expansion of the urban growth boundary beyond the city of Eugene, which will put pressure on rural land development, which of course will have an impact on the financial stability of the county. So thank you for the presentation. I welcome the numbers. I welcome what Commissioner Burney is asking for, and I look forward to making certain that we do our best to facilitate the development of residential properties.
Okay.
So
Go ahead.
real quick question on actual versus budget here.
Yes.
Which is part of what is
Yes,
the main
part
reason
of the
for the report.
yes.
Why is federal revenue only at 30%, 3/4 of the way through the fiscal year?
Well, a big piece of that is not receiving the Secure Rural Schools payment through March 31st. Now, we have received a piece of it now. So some of that is just going to be slower to come in. It's the reimbursement schedules that are occurring. I'd have to check on the Medicaid piece and see how long that takes, is another big piece of our federal revenue. So it's a lot of it's just timing of when it comes in. And yeah, looking back to March 31st, even today, things look different than this report.
Yeah. So I was just surprising to see it lagging by that much. And I noticed debt service is also, as an expenditures is significantly low. Is that because our debt service gets paid in lump sum, or is it?
Right, there's like a payment in November and then June, I think. Yeah, and
Okay.
sometimes it's a smaller one in November. Yeah, just depends on that debt schedule for each bond.
I didn't know if it,
Yeah.
I'm used to paying a mortgage where you're paying your debt
Right,
service
yeah,
monthly.
these are like
so-
twice a year, so they are a little different.
Okay, just was curious about that, yeah. And I did notice that when you look at the general fund operating revenues, that the federal revenue is down 75% from the previous budget year.
Right.
And that's the pure timber harvest versus Secure Rural Schools is making that difference? Is that why that's
Some of
so
that
much
is also
lower?
going to be the U.S. Marshal changes over the years. We actually have Secure Rural Schools in 1819, but of course you have a step down.
Yeah, okay.
Yeah.
Just seemed like quite a difference. Yeah, I also know that the burn grants got eliminated for Oregon with the current administration, so that might be some of the revenue too.
Right, yeah, and this then, of course, is also showing you that I think by March of last year, we had received our Secure Rural Schools payment, and this year we haven't yet. And like I said, we're expecting it any day now in the general fund. We've received the road fund piece, so you're seeing that we're missing it.
Yeah.
Yeah.
And I understand it will not have the sequestration pulled out of it. That was a recent notice we got through the ONC Association.
Correct,
Yeah.
yeah. The federal, yeah, they actually did do sequestration on the road fund piece, but it was caught, and now it'll be coming back to us, right? Yes.
Great, thank you.
Yeah.
Okay, well, thank you very much. We really appreciate this report and the discussion about it. Thanks so much. We're ready to move on to County Council. Item 6A, County Council. With us to join us is Steve Dingle, Lane County Council. And Mr. Dingle, we have some opportunity for you to make announcements.
Yes, I only have one announcement. While I'm out of the country, Sebastian Tapia will be the acting county council until whatever Memorial Day is, the 26th, beginning Thursday afternoon. That's the only announcement I have.
Okay, and I wanted to ask you about the recent email you sent to the board regarding the Oregon Government Ethics Commission and their work and the timeliness of their activities and how Lane County employees in particular, but not just limited to Lane County employees, just anyone under the system of their process of giving advisory opinions to people.
Sure.
And I wanted to have you go into a little more detail than your email went into when you sent it last Thursday.
Sure, Chair Sorensen and members of the board. First of all, let me just say that I think the Oregon Government Ethics Commission is one of the best run state agencies that we have. They typically respond in writing to an email request within 2 or 3 business days. I don't think I've ever had them take more than 3 business days. You all have received training from them. They're very welcome, very open to county council conferences. They are always willing to come down and present, either at our one in Bend during the summer or the one that we host here in the fall. A lot of people don't know, I think they think of you as public officials, and you certainly are public officials, but for purposes of the Oregon Government Ethics Act, virtually every employee at the state, or at Lane County is a, quote, public official that's governed by those acts.
Every citizen, volunteer, and advisory committee.
Everybody, yeah, everybody. And so things that requests that you make, I think are obviously much more high profile, but I can tell you that I encourage and strongly recommend to our employees that they take advantage of this resource, because again, they've been very responsive. So for example, just before this, I was kind of going through that folder and looking at the kinds of things that employees have asked about. Comes up frequently about the $50 gift thing, how they'll go to a conference and win something in a raffle. That's a very common one. Someone will want to sponsor them and pay for part of their travel. That comes up frequently. And in every instance, the commission has responded, provided a written opinion, not unlike and again, you actually see in these two, it's interesting, the two that I forwarded, you see the two different types of opinions that the Government Ethics Commission provides, right? You've got the one, which involved Commissioner Farr, which is the sort of, I think they refer to it as informal. It's not a technical safe harbor, but I have not heard of anybody who has followed, as long as the facts that were provided were accurate, that has followed the advice, that has ever gotten in trouble with the Ethics Commission for following that, what I call informal email advice. And you'll note that that's done by Ms. Hedrick. She's one of their rock stars as far as I'm concerned. Tammy does a great job, and she's a program analyst trainer. And then you see in the other one dated March 27, 2019, which is clearly a much more formal letter, and it's actually signed by Mr. Burson, who's the executive director. And so those tend to be actual safe harbors. As long as the facts are as presented, if someone were to bring a complaint, and you have one of those letters that essentially says it's a get out of jail free card, even if the commission were to somehow reach a different conclusion, again, assuming the facts were all the same. So that's kind of the background. And again, I certainly, although each one of you are individually responsible for your own personal ethics, I've again strongly recommend that you take advantage of the resource that is there. I know that Commissioner Buck has used it. I know that Commissioner Bozievich actually didn't have to use it, I guess, the one time because he had actually gone there. Commissioner Farr. So it's a good resource, and they do fantastic training, and we don't want any of our employees to get in trouble. Nobody wants to get dinged by the Ethics Commission. So that's basically the background. And that's the way that I use it.
This, for example, this came up recently where, right here at the board, where Commissioner Burney was concerned about the liability of the people on the council for the workforce partnership. The board appoints someone to be on the workforce partnership, and now, all kinds of things come up. Well, one of the benefits of writing the Ethics Commission is that you then follow, assuming you tell them what the facts are and assuming you follow their advice, then if somebody later comes back and says, well, he did something wrong, you get you don't get any penalty for that. They may make a decision that's different from their letter, but that's going to affect other people down the road, not you. The other thing that comes up is that we have citizens come to us and say, hey, I want to be on the blah, blah, blah committee, or I can't believe that you put me on the blah, blah, blah committee just because I wasn't there when they were picking the members. And so now these people become public officials where all they've done is volunteered on the Law Library Advisory Committee, and now all of a sudden they're a public official, and they don't think about it, and unless we bring it to their attention and remind them that, hey, this service is available to them too, and so, and last but not least, I'll mention that the opinions are all on the Ethics Government website, and so if you have a question about how to formulate your question, you can look at how other people did that.
I should say, actually, they've done, and this is something that they've done in, I want to say the last 6 or 8 months. It used to be extremely clunky to try and find an opinion. And I use this example, the sheriff's office, I got a request. A cell phone company was offering a reduced cell phone package and giving priority to first responders in the event of an emergency. And the question came from the sheriff's office was, can we have our folks take advantage of this offer? Well, I went to the government ethics website and I did a search, and lo and behold, up popped a letter from Washington County asking about the very same service 4 months earlier. And essentially what they came down to in that letter was that as long as the member of the sheriff's office would not be involved in scoring an RFP or signing an RFP from that vendor, that the individual deputy would be fine. But I use that as an example because, again, I literally found that opinion within 10 minutes of searching for it. So it is a lot easier to use than it used to be. And the other thing I was going to say about when you make these requests, my view is that you are always, it's always better to ask these things because, as you mentioned, Chair Sorensen, these are a public record, and it just, as a former prosecutor, I didn't see too many criminals who were going to do something wrong that went to the regulatory agency or the police and said, I'm going to go do this. So I think when you're transparent like that, I think it really does, because one of the things the Government Ethics Commission at times takes into account is what the person's motive is, and it seems to me your motive is good when you write in advance and you publicly and in a transparent way say, I have this question. It just seems to me that dishonest people don't do that. If you're going to do something wrong, you certainly wouldn't write the Government Ethics Commission and lay out your plan.
Okay, Commissioner Farr.
I'll say more about this just before we go into executive session today, but thank you, Mr. Dingell, for submitting that letter at my request, giving a greater definition regarding my role as a county commissioner and the negotiations discussion regarding ASME. It has allowed me to look at it from a slightly different angle, and thereby, when the time comes, make a slightly different declaration of potential conflict of interest. You say it's technically not a safe harbor. You ever heard of Briggs Landing? Briggs Landing is now called Boiler Bay, which was called a safe harbor. It's not a safe harbor, really. So technically not a safe harbor does not necessarily put me on fully stable ground, but it does allow me to make a slightly different declaration of a conflict of interest.
And I will say, Commissioner Farr, I am not aware of any circumstance where a person got what they call the informal advice, like you got, that the commission has, subsequently someone filed a complaint over the same issue against the same person, and they found them to be in violation.
Yeah.
I think it is in statute that technically it's the true only safe harbor, but I've never heard of them doing it otherwise. So.
And once again, thank you very much for submitting the letter. It's verbose, the response, and it's improperly punctuated, making it even harder to read. But it does give me an ability to look at things through a different lens. Thank you.
And one of the things that the reason I forwarded it to the entire board is I thought both letters gave a really good sort of general discussion of the issue of conflict of interest. And I sometimes do the same thing with employees when we get when there's a question that is one that is of a reoccurring nature, for example, regarding the acceptance of gifts or winning something at a raffle at a conference. I will distribute that out because they tend to do just what they did in both of these letters, where they talk about the general framework before they talk about the rule in general before they apply it to the specific circumstance. So there's value in people seeing that and saying, okay, this is how the Oregon Government Ethics Commission looks at and analyzes one of these issues. So that's why I sent it to everybody, because I thought they were both good examples.
I will give another little example, and that was right before Ms. Hedrick's training last February or March, whenever she did her training here. My granddaughter was selling Girl Scout cookies. And in a phone call between my wife and daughter, my wife said, well, you know, maybe Pete could have some Girl Scout cookies at the courthouse. I saw that whole area up there in the commissioner's office where they got their food and refrigerator. And my daughter jumped in the phone call, who works for the state of Oregon in Portland, and said, no, I'm sure he can't do that because at the state, we can't do that. And that very issue was raised in the training with Ms. Hedrick a few days later, that, no, that's an example where you have a certain job as a public official, and not everybody can go up to that kitchen area. And so, no, you can't use your job, and that would apply to anyone that worked in the county government, not just commissioners. That would apply to anyone. So that's an example where somebody who didn't know that, they could either find out about it by looking at that website, or if they didn't know and didn't have the time, they could just send the email in and say, hey, can I do that? And then they'll tell you pretty quickly, too.
Well, and a lot of times what I'm finding is that if you go in and use their their new database, that you'll find a lot of this. There are very few things that are absolutely new under the sun. That you'll go in there, and if you, like I said, I mean, you know, you enter cell phone packages, because this is, as a matter of fact, that was a very hot issue when cell phones first came out. Is that cell phone companies were willing to offer a lower rate to government employees because they were assured of repayment. That's back when it used to be like, you know, $7 a minute. And that was always the question, is can a public employee accept the discounted cell phone package or cell phone program? And so there's lots of things that I find in there that are, that, like I said, even though that may not be the specific issue, the facts might be a little bit different, but the generic issue, like I said, how you calculate the $50 gift figure and stuff has application to what I'm looking at.
Yeah.
Or what the employee is asking.
Any other questions? Okay, thank you so much, Mr. Dingle. Okay, we're ready to move on to item 8A, and that is Commissioner's business. Are there any announcements from any commissioners? Commissioner Farr?
Thank you, Mr. Chair. I'm actually going to read a letter. And this is pertinent because a lot of times things don't become important to us until we have a reason to taste them, a reason to feel them. And I'm going to read a letter to the editor that was in last Thursday's newspaper. It's very short, but this no agricultural worker should suffer or die by chlorpyrifos. I'm a first-generation Mexican-American. I'm a parent. I'm also the child of a victim of agricultural pesticide exposure. Through the 1970s and early 1980s, my father worked in fields, orchards, and vineyards in the U.S. He and others were not only exposed to pesticides, but they were also given irrigation water to drink throughout the day. He was exposed to one of the most damaging pesticides, chlorpyrifos, a powerful nerve toxin. I was not yet born when my father began to show symptoms that would later come to be associated with prolonged pesticide exposure. His fatigue, weight loss, nausea, vomiting, and rash were alarming. My father would eventually succumb to non-Hodgkin's lymphoma when I was less than 2 years old. He died in pain. He died slowly. He was a young man. His name was Dionisio. He was 24. I'm here to speak on his behalf. Oregon lawmakers are considering a ban on chlorpyrifos. The ban will set a precedent, one that states firmly we will not let another worker suffer in the way my father did. It's a step toward the future ethical agricultural practices that value human lives. So his name was Dionisio. Now I mentioned that sometimes things come home, and sometimes things that we've been thinking about for a long, long time come home. Dionisio Gomez is the other grandfather of my grandchildren. my daughter-in-law wrote this letter. So my grandbabies will never see their grandfather. He was, because of the reasons stated in this letter. It comes home in particular, and not that I hadn't thought about the issues, but as soon as you see it in the faces of children, it becomes a little bit clearer. And over Mother's Day, we looked at pictures of Dionisio. When Yola, my daughter-in-law, was very, very young, him holding her. And really, you know, once again, when it comes home, this is not an alarmist letter. This is not a made-up letter. This is actual factual truth. And it's reflected in the faces of my grandchildren who will never see their other grandfather. Thank you.
Thank you. Other commissioner announcements? Okay, we are then moving on to, well, maybe I should bring up these two things right here under announcements. I'm going to announce that I have received a letter from the DUII Impact Panel. That's a Lane County nonprofit. And the letter, which I'm pretty familiar with this group, I helped in the starting of it, and and I was on the board for a number of years, and then Commissioner Stewart was on the board a number of years. But their letter says, May 2, dear Mr. Chair, this letter is to formally request a consideration of a Lane County Commissioner for nomination to the Board of Directors of the Lane DUII Victim Impact Panel. The Lane County DUII Victim Impact Panel was created in 1980 and is a separate entity from government or other organizations. The mission is to prevent future pain and suffering caused by impaired driving. We strive to educate as many offenders arrested for driving under the influence of intoxicants as possible. Outside of mandated attendance by court referral, we organize and conduct programs that educate the general public about the seriousness of driving under the influence of intoxicants. I won't read the rest of it, but they would like to have the Board of Commissioners appoint someone or nominate someone for this board, and they included their list of all of their members, and those include the DA, they include the Chief Criminal Judge of the Circuit Court, Barbara Steffler, who of course is the founder of Lane County Mothers Against Drunk Driving here in Eugene. Lots of different people. So I'll pass it along to our county administrator just to have maybe a copy made for the commissioners. And we don't have to take action on that now, but I'll ask you to think about it. It's really a worthwhile group. I think. Well, I think.
Sounds like you served there before.
Yeah, I think that what they're trying to do, since Commissioner Stewart was never, what do you call it, replaced, I think they're trying to remind us that we have not had a commissioner on the board, and so we'll for now we'll do that, and then the other thing is we got Commissioner Farr as the board chair forwarded to me, and this letter from the Census Department. I guess I'll just say that I haven't read it, and it seems to be organizational, so I don't really want to take up too much time here, but I'll suggest that we pass this along to the administrator and see if there's some response. I'll give you that after the meeting, Steve. Okay. So are there now any other agenda team requests or work session requests? I have one. I know Commissioner Buck needs to be recognized here. Any other ideas? Okay, so why don't we call on Commissioner Buck, then Commissioner Farr.
Thank you, Chair. I have been invited to an event on May 30th in Boise, Idaho, with Senators Wyden and Crapo for their announcement of the Forest Management for Rural Stabilities Act. This has been a widely supported and bipartisan effort, and there will be lots of representatives there, but they wanted to ask for a representative from Lane County, and I would very much like to go and would like to get the support of the county as well. since it is out of town, there is some expense for travel. I've looked up online, and it's about $350 to $400 for a flight to get there and back. But I think it's important that we represent the county at this significant event, and just hoping to get some head nods from the board to do so as a representative of Lane County.
Yes.
I think that's a good idea, and congratulations on that. I think that, from what I understand from Ms. Jones, that commissioners are, of course, able to travel without board approval, that we have a budget for that. But we're drawing a distinction, as I understand, to have you as the official Board of Commissioners representative. Okay. So are there 3 head nods for this? I'm 1. Okay.
Yeah, although I'd like to amend it.
No, there aren't, there are 4.
4, 5. Okay. Yes, sir.
Yeah, I want to support it so long as Heather is identified in front of everyone as the.
There'll be lots of people there.
Lots of people. Okay. Just if that
I was telling you.
Wyden guy or that Crapo guy, I mean, they could be put off to the side while you. Yeah, no, thank you. Okay, are there any other, Commissioner Farr, and then I have 1. Okay.
And this is a request, but not necessarily for a work session. This could come just as a declaration. I'll leave it to the discretion of the agenda-setting team. It's a request for a discussion at a county commission work session. The request is by the Spreading Kindness Campaign, a Lane County-based organization focused on promoting kindness in schools, businesses, neighborhood, faith communities, and government. And the things that what they believe is kindness is a critical variable in the well-being of individuals. Organizations of all types can reap tangible benefits from proactive kindness, and kindness builds trust and help bring a community together for uncommon purpose. Now, I'm not going to go on to read the entire letter, which I'll forward to everyone, but I'd like to request that the city of Eugene has committed to becoming a city of kindness, and I'd like to have a discussion at this point. Now, kindness seems a little bit trite, doesn't it? Who wants to be kind? Well,
I'm pro-kindness.
And really, we all are. But if you read the letter, it gives some really tangible reasons to actually make the statement. And I'd like to forward it to all the commissioners and forward it to the board chair and vice chair to consider as some form of action by the Board of County Commissioners. And I'll get it to you in the next, during the lunch break. I'll forward it by email.
Yeah, I think that although it's easy, and I guess I just attempted to do so, it's easy to make fun of this. I don't think it's actually something to make fun of. I think it's really important, and things like professional courtesy and kindness and doing things with some kind of intentionality of trying to be as polite as we can in our lives is really an important thing. So I think this is a great suggestion. I will certainly say I'm for that. And if there is anything specific to do, let's make it specific, and we'll try to incorporate that.
Mr. Chair, thank you.
I wanted to follow up our Board of Health meeting and make a suggestion if there's board support for this. And that is, I don't know who this letter could go to, whether it goes to the governor or the president of OHSU or it goes to the Oregon Health Authority or all of the above. But I'd like to consider asking our Health and Human Services folks for a letter, a board letter, that they could present for consideration by the agenda team. And the letter would basically say, you know, hey, we would like to have a residency program or more than one residency program in our community. That this is something that's been discussed by policymakers, people in and out of government, people in and out of the medical profession, people in and out of health care delivery. And we have a big role in this, in our role as the operators of these health clinics. We have a big role in this because of our public health. We have a big role in this for lots of reasons, and we would like to advance some energy on this. And I don't want to write the letter here, but I do want to get board approval to have Ms. Gaffney and her people write a letter like this. You know, and I think it's a good follow-up to our meeting today. Yeah, okay. I'm seeing more than 3 commissioners, and we'll just make that a vague in the sense of no time certain, but a request.
Okay.
So it's a specific request without a specific time.
And I'm glad the Mokrahasky family is doing their share. By the
That's right. They absolutely are. Okay, so are there any other items? I think we don't have an executive session. We don't have any other business. So I think we're done until 2 o'clock. So the board meeting would be concluded. We will not be meeting tomorrow. We are meeting next Wednesday, by the way. We are meeting next Wednesday morning, 9 o'clock, for a short meeting. So we'll have a big, long meeting on the 21st, and we'll have a short meeting on the 22nd. Any other questions, comments, concerns before I adjourn the board meeting? Okay? All right, so we are adjourned. See you at 2 o'clock.